In the early 70s, they did away with patient labor, basically. And they hired more help.
And after that, they started to think of things for the patients to do, basket weaving and little things, but they're all make work. There has to be a value to what you're doing. And that adds a lot to your sense of self-worth and self-satisfaction. And so when they stopped the patients from working for weeks and even years, the patients would show up every day for work.
There were still some patients on the wards, individually and off the record, that loved to work. If patients didn't work or weren't on work squads, like out cutting grass and that kind of thing, they would just wander the day room, pace back and forth. I remember they used to, for polishing the floor, they'd make these concrete blocks and wrap a blanket around it with a big wooden pole. So for the patients that were active, they loved to pace all day, and many of them did. They'd talk to themselves and they'd pace. They'd give them one of these big concrete block with a blanket and a pole, and they'd push it back and forth to shine the floors.
It wasn't until, I would say, late 1930s when they started to warehouse the patients. That was when they started to build these very, very huge buildings, like Building 93. At one time, they had 10,000 patients there.
Maybe as many as a third of them had some kind of organic illness that meant they were never going to recover their sanity. It wasn't called schizophrenia, but we look back, clearly there were people being hospitalized in the 19th century who suffered from schizophrenia, a disease that, again, we have no cure for. We can palliate it, but we can't cure it. People who clearly were suffering from major depression, and there's no Prozac, there's no, the medical treatments were few and far between. In terms of precursors to the psychotropic revolution, there's surgical lobotomy, there's electroshock therapy, there's insulin coma therapy, very aggressive physical treatments. But none of these treatments were really able to empty the wards. The peak population at Kings Park was around 9,000 people. You weren't going to give them all lobotomies. But it was possible to think about giving the majority of them some kind of psychotropic drug. In the 19th century, families had to pay the cost of hospitalization themselves. If you were already barely putting food on the table and a roof over your head, and mental illness struck a family member, you were going to be thrown on to the public welfare rolls. The burden gets to be so big at the local level that's when the state governments come into the picture. They set up a state system, and they start taxing at the state level to set up state mental hospitals.
The census of people in mental hospitals in the United States rose quite dramatically, I think from about 100, 150,000 all the way up to 558,000 and when it peaked in 1955.
And later the federal government get very active in policy issues because they have an incentive to try to figure out new treatments because they basically want to lower the costs.
At the point in 1955 when they started introducing drugs into New York State facilities, mental hospitals were the second largest item on the New York State budget after education.
I mean, the real drive behind deinstitutionalization was to save taxpayer dollars. Their hope is they can find a quick fix, get people better, get them out of there, and thus lower the tax burden.
And then there was, after they discovered drugs and the use of drugs, a movement to deinstitutionalize the mental hospitals.
You get this idea of community mental health, that the most humane way to treat people is with the least amount of restriction, that you want to return them to the community. This is possible now that you have better drugs. So we get the introduction of community mental health as an improvement. We have the new drug treatments. that's when we start to see the numbers of people in mental hospitals start to come down. It begins in the late 1950s, and it continues dramatically through the 1970s, 1980s, until there's so few patients in most big mental hospitals that the majority are closed down. Again, you'd think this is a wonderful success story. Unfortunately, was done in such a way that it maximized cost reduction. The reverse side of that, where community resources were supposed to be made available, that did not happen.
Despite all the emphasis about deinstitutionalization and community mental health care, they never provide the facilities, and they never create any linkages between patients as they were released and where they were going to in the community. So people would be released from a mental hospital, and there wouldn't be a facility there that would welcome them. There wasn't a facility that you could send them to or link them up with a caseworker or a social worker in those communities. And so gradually, over by the 1970s and early 80s, what you began to see was people standing on street corners who were homeless, talking to themselves.
They were like, one day you're institutionalized, the next day you're out on your own, take your drugs, and everything will be fine. And it wasn't like that. That's why the homeless problem, especially in New York City, exploded during the 80s, was because all these patients were being released from the institution with no follow-up care.
We also see the new mental health system of the late 20th and early 21st century is the prison. The percentage of prison inmates who have a psychiatric disorder has gone up dramatically. So in a sense, prisons have reinstitutionalized many people with mental illness.
Well, I went there in 1957 at 22 years old, just out of the Navy. Well, some small little isolated cases of people that I was very impressed with, patients in particular. Alvita was a patient who made kites, handmade kites, and he'd make a camera, put the camera on the kite, and he'd fly the kite, and he'd take aerial shots of the state hospital when he was a patient. So he made a kite from scratch and a camera from balsam wood, and he would take aerial photos as a patient. So there's some interesting characters around here, you know. I mean, there's just something mesmerizing about the whole thing. I don't know, I just look at it and think all the people that have come and gone over the years and the happy times I had there. You know, and, I think the patients were well off there.